Hey everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. Today we'll be discussing the medication known as Tapentadol. Its brand name is Nucynta. Now before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. And quickly, if at any time during this video you find the information to be valuable, please consider leaving a like on the video as it would really help me out with the YouTube algorithm. So first off, what will we cover in this presentation? We're going to start by talking about how tapentadol works. We'll then discuss indications or reasons we would prescribe this medication to a patient, then contraindications or reasons we would not be able to prescribe this medication. We'll follow up with an example of dosing, and then stick around to the end where we'll talk about side effects with percentages. So how does tapentadol work? Well, first of all, it's a centrally acting synthetic analgesic. Its analgesic activity is due to binding to the mu-opioid receptor and inhibiting norepinephrine reuptake. Now, what about indications or reasons we would prescribe this medication? So we typically see it prescribed in chronic severe pain in patients who are requiring long-term, daily, around-the-clock opioid therapy. And we also see it prescribed in diabetic peripheral neuropathy when the pain is severe. Now, contraindications, or reasons we would not be able to prescribe this medication. So the first one would be if a patient had a hypersensitivity or allergy to tapentadol or any other component of the formulation. They would also not be able to use this medication if they used a monoamine oxidase inhibitor in the previous 14 days. It would be contraindicated in patients with severe or acute bronchial asthma if they're in an unmonitored setting. It would be contraindicated in patients with significant respiratory depression and in patients who have a gastrointestinal obstruction. Now for dosing with tapentadol. So first off, patients have to take into account prior analgesic treatment experience and risk factors for addiction, abuse, and misuse. They should always try to use the lowest effective dose for the shortest duration possible. If they were using the immediate release formulation to treat their pain, they may use 50, 75, or 100 milligrams orally every 4 to 6 hours. And they would then adjust the dose based on pain and adverse effects. Now, as with all medications, there are some side effects or adverse reactions that patients may experience while using tapentadol, so I'll go over some of those here now. So dizziness may occur in 17 to 24% of patients, and 10 to 15% may experience a headache. 1 to 15% may experience somnolence. Constipation comes in at a rate between 8 and 17%, and nausea at a rate of 21 to 30%. 8 to 18% of patients may experience vomiting. Now, some more rare but serious side effects would be hypotension or low blood pressure, suicidal thoughts, or respiratory depression. That's all we're going to talk about today with tapentadol or Nucynta. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information to be valuable and you'd like to help grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. That's it for today. Take care.